Our final patient is Sue. She was diagnosed with rebound headaches. Sue, why don't you tell us about your headaches? How did they begin?
About 3.5 years ago, I came down with Bell's palsy, and about 3 months later, I had my first headache.
You'd never had a headache before?
No.
Did you know what headaches were like?
Never. I rarely ever even felt a pain in my head. I never even really took aspirin.
What side of the face was the Bell's palsy on?
The left side.
And where was the headache?
On the left side.
Left side. What part?
Probably about the middle on this side, kind of back.
Okay. Did you have any other symptoms with these headaches, like nausea or vomiting?
No, not at all.
How often were you getting these headaches?
Well, when I first started having headaches, I may have 1, maybe 2 a day. And to help the pain, I would take 2 to 3 Advil. Then I noticed over time, and we're talking over a few months at first, that the headaches were getting harder and they were becoming more frequent, to the point that I was having maybe 3 or 4 headaches a day, and they were harder, and it was taking 5 to 6 Advil a time to relieve the pain.
Now, did you come back to see me in that time frame?
Yes, I did, and you did an MRI, and basically the MRI, from what I understand, was clear. You wanted to make sure there wasn't anything wrong, because I'd never had headaches before.
Okay, then what happened?
And then basically I felt like I would just be getting okay, and so I just was taking Advil on my own.
Did you go to the doctor?
Yes. I was seeing my family physician just for different things, and when I would go in, he would ask me, well, are there any problems? And I told him that I had headaches, and he said, okay, what are you doing for them? And I said, well, I'm up to taking 18 to 20 Advil a day. And he at that time said, well, that's okay, that won't hurt you.
And then what happened?
Last spring, I went to my gynecologist for my yearly checkup, and I mentioned to her that I was having these headaches and that I was taking a lot of Advil. And at that time, she said, you need to get back to your neurologist, and that's when I came to see you again.
When you came to see me, how many Advils were you taking a day?
Well, it depends. Sometimes I take 18 to 20. If I had more headaches than that, I may take up to 24, Advil a day.
How many Advils were you taking after every headache?
Usually 5 to 6.
Okay, so you would take 5 to 6 Advils with a headache.
Mm-hmm.
What would happen to the pain?
The pain would go away.
Then what would happen?
The headache would come back, usually about 4 or 5 hours later.
Then what would you do?
I would take Advil again.
Okay.
And the cycle just would repeat itself. Every day, that's what I went through.
Okay, so you were taking large amounts of Advil for these recurrent headaches.
That's right.
Then you came back to me again, and what did I do at that time?
And that's when you said, I believe you have rebound headaches. And I'd never heard the term before, and you put me on steroids, prednisone, and you started me with a higher dose, and then you decreased it over about 2.5 weeks. And after that time, I felt great. My headaches were totally gone. I didn't have a headache for about 5 days.
What happened then?
Headaches came back, and I started taking Advil again on my own. I didn't call you, and so I just thought, well, I guess I have to take Advil again.
Okay, then you called us.
Then I called you back after I started doing that, and I realized, this isn't working. And so I came back, and that's when you put me on Vioxx, and you started me on about 12.5 milligrams twice a day, and that did help. But it just wasn't totally getting rid of the headache, and it was taking a long time to get rid of them. And so you changed me, first of all, to 25 milligrams of Vioxx twice a day, and then I wasn't having a headache for 2 or 3 days. And now I've gotten to the point to where I'm only taking 1 Vioxx a day.
How often are you taking the Vioxx?
Well, I said once a day. I'm not taking them once a day. When I take it once a day.
Right.
And I only take it maybe every 3 to 4 days, depending on when I have a headache.
So in general, your headaches have gone down tremendously?
Tremendously. The pain is nothing like they were.
So you're taking 1 Vioxx, have a headache, relieves the headache, then you go 4 days, may need another, and this is 25 milligrams of Vioxx?
Yes.
And how do you feel about the way the treatment of your headaches has taken place?
I am very happy. I'm very happy. I'm very glad I tried something else, I guess because, I'd never even heard the term rebound. I didn't know what I was dealing with. I thought I was just, well, I'll just take Advil. And so I'm very, very happy.
Sue has classic rebound headaches. The headache can be stopped with minor analgesics, but soon returns and she has to use the analgesic again. This pattern may be repeated several times during the day. The only treatment for rebound headaches is to remove the offending medication, in this case Tylenol. After the medication is removed, one can use an anti-inflammatory agent or steroids while the offending medication is tapered. Usually the headache resolves. Most primary care providers are unaware of this common type of headache